A number of medications have been harder to find throughout the inland Northwest and the rest of the country. Now, health systems are facing a shortage of Albuterol. That is a drug used to treat those with breathing problems. Good evening and thanks for joining us. I'm Emily Bloom. Jordan Smith has the night off. Bronte Suratsky joins us in studio with the impact these shortages can have and what doctors are doing to treat their patients.
Well, albuterol is a drug that helps open up the airways. It's used in inhalers and nebulizers in hospitals. With respiratory issues still causing hospitalizations and making people sick, especially children, MultiCare tells me they're changing the way they distribute these drugs to adults to help kids that may need it.
Since it involves children, it's very difficult.
Winter is already a time when healthcare systems like MultiCare see a rise in respiratory illnesses. And albuterol, the medication used to treat those illnesses, is in short supply.
Yeah, it's really a very, very difficult situation. It's a critical shortage. We've been focused on this for quite a while. It mainly impacts our children, the small children who are in the greatest need of this medication. It's respiratory season.
Children battling respiratory illness need to take this drug in high concentrations and continuously. MultiCare says it's been only using high concentrations in adults as needed.
We haven't run out yet, so we're really focused on saving and reserving the high concentration form of this for the children.
To make this work, healthcare workers have been putting in extra hours.
And so we've had staff with all hands on deck. We've had staff work overnight a number of times to make sure we had enough. But we will, and we do. But yeah, it's very stressful, difficult, critical shortage.
He says that although MultiCare has had to make a few changes and some adults have been getting a lower concentration of the drug than normal, MultiCare hasn't seen anyone harmed yet because of these shortages. And the reasoning behind these shortages has to do with an increase in demand for this medication because of surging respiratory illness mixed with supply chain issues. Live in studio, Bronte Suratsky, 4 News Now.